Good morning, everyone. I'm Linh, a neurologist at Tâm Anh General Hospital. Today, I'm very honored to present our research. MRI of neurovascular compression and its correlation with the efficacy of botulinum toxin treatment in patients with primary hemifacial spasm. Hemifacial spasm is a unilateral facial movement disorder characterized by irregular contraction of muscle innervated by the ipsilateral facial nerve. Although it's not a life-threatening disease, it can reduce the patient's quality of life. It is generally believed that primary hemifacial spasm is caused by vascular compression of the root axis zone of the facial nerve. And a new technique, the development of new technique MRI has improvement the detection of the detection of neurocompression, and MRI 3D were used in all patients with hemifacial spasm. About treatment, we have surgical treatment, and microvascular compression is the most effective therapy for this disease. It treats the disease by eliminating the neurovascular compression. However, the surgical treatment requires a team of professional surgeons and requires a high cost. So in the practice, we prefer botulinum toxin is still preferred. Our question is whether the neurovascular compression have any correlation with the efficacy of the botulinum toxin treatment in patients with primary hemifacial spasm, and based on the MRI imaging on MRI, we can predict this case, that case may respond well to treatment or not. So the purpose of our study was to describe the MRI cyst imaging of the neurovascular compression at the facial nerve and to examine its correlation with the efficacy of botulinum toxin treatment in patients with primary hemifacial spasm. A total of 58 patients with primary hemifacial spasm were included in our study and underwent MRI 3D cyst of the facial nerve and were treated with injection of botulinum toxin at Tâm Anh General Hospital. And for all patients, this was their first treatment with botulinum toxin. And the severity of the disease was evaluated according to Jankovic rating scale. Neurovascular compression on MRI is divided into 4 levels according to the increasing of severity. Grade 0, there was no conflict. Grade 1, light touch. Grade 2, compression caused deformity or deviation of the facial nerve. And grade 3, we have multiple vascular compression. And the response to the treatment was assessed by the Surrender score. And we can see here, the higher the Surrender score, the better treatment effect. The result of the research showed that the positive rate of neurovascular compression of the symptomatic side was higher than non-symptomatic side, and this result supports the association between the neurovascular compression and the result of the spasm in clinical. And MRI identified 56 patients, 56 cases of neurovascular compression, and grade 1, 10 cases, grade 2, 33 cases, and grade 3, 13 cases. 2/3 of patients had compression at the rest of the facial nerve, and the mainly offending vessel was the inferior cerebellar artery. Our finding was consistent with the previous report in the world. We can see here the neurovascular compression at the root axis zone. Here, the neurovascular compression grade 2, and this image shows that vascular compression at the root axis zone of the facial nerve in grade 3. This image shows the grade 3 of 2. We can see at least the 2 vessels compressed the facial nerve. And between 2 groups with grades less than 3 and grade 3, there was any difference in terms of age, of duration of disease, Jankovic rating scale, and the dose of botulinum toxin. The mean surrender score of the grade 1 group wasn't different from that of grade 2 group, but the mean surrender score of the grade 3 group was lower significantly than that of the other 2 groups. And the ability of to achieve the good result of the group with grade less than 3 was 6 times higher than that of grade 3. And to discover for this difference, we suggest a hypothesis that the demyelination of the group with severe compression is more extensive. We conclude that MRI 3D cyst should be performed in all patient hemifacial spasm patients for the detection and evaluation of neurovascular compression, and patients with minor neurovascular compression experience a rate of improvement after botulinum toxin treatment compared to those with severe compressions, especially in case with multiple conflict visible on MRI. Thank you for your attention.
Thank you, Dr. Linh, for your presentation.